have the reason why we are here, the goal of this webinar, and then we'll introduce our first speaker maybe along the way, so that we don't wait for long and then we lose people. Because sometimes when people come on and they find we are not started, they will exit and say I will join later, and then they don't come back. So I will request that we start with an opening prayer, and then we will have a brief introduction of every one of us, and then we can go to why we are here. Let us pray. Heavenly Father, we thank you for this morning. We thank you for this webinar. We thank you for you have given us an opportunity to talk about how we can guard, protect, and preserve the rights of mental health. And through this awareness, we pray that we will be sensitized, we will be quickened to understand the things that we have to do for ourselves, for people in our care, for people in our communities, so that we'll make everyone safe and make a safe space for everyone to thrive mentally. We thank you for our able speakers who are going to speak to us. We pray that you will give them utterance, they will articulate matters well, and will be sensitized and educated and made aware, so that we'll be able to implement the things that we are learning. And we pray that we will manage well the resources, especially resource of time and other resources around us, all for the glory and honor of your name. In Jesus' name we have prayed. Amen. Amen. So we for purposes of also allowing other people to join in. So I will start by introducing myself, and then we'll follow. You introduce yourself, and then you invite the person next to you on the chat, as you will be seeing. My name is Arthur Ayodechide. I am the chairperson board of this organization, and I am very happy and excited to be here. We are here to talk about mental health and how we can implement, complement, help people in our community, but most importantly, help ourselves. I'm a lawyer by practice. I pastor a church also, and I am glad to be here. And the next person on my chat is Alan. So Alan, introduce yourself, and then the next person will follow.
Hi everyone, it's nice to meet you. Thank you for bringing me in, Arthur. My name is Alan Cimenta. I'm a dear friend to Sarah and the family. Thank you for having me today. Yeah, that's it from me. I don't want to bring in the job thing and everything else.
So who is next to you on the chat?
Is it Helen?
Yes, Helen.
Okay, thank you very much for the opportunity this morning. Arthur, thank you so much for allowing us and our mother for have this opportunity to share something that is very pertinent to our society today. My name is Helen Mbabazi. I'm the wellness coordinator with Minet, Uganda Insurance Brokers. But also I'm an administrator with the Phaneroo Ministries International Church, a lover of Christ, a lover of God. I think if anybody needed to describe me on this group, I think that's the best way I would like to be described. But also allow me to say that in this space, one of the biggest concerns and my passion for is to see how to save the generation from what is happening, because I see the consequences of what is happening. Part of what we are going to talk about today in adults that I really do counseling for the workspace. So I'm very happy to be here, very honored, and I look forward to a wonderful conversation that will change all of us. Thank you.
Helen, who is next to you on the chat?
Let me read out the people to do. Let's have Ariatunga Brenda.
Hi everyone, my name is Brenda. I'm a country director here in Together, Uganda. I'm based in Mbara right now. And I'm so passionate about what I do on a daily basis. So I'm really so glad to be on this very platform. Yeah, thank you.
You're welcome. Barbara Lamara.
Before
I think she was still saying something. Okay.
Sorry. Her network wasn't also clear.
Okay, sorry about that. Good morning, everyone. Thank you for organizing this platform. I'm very happy to be on this platform. My name is Barbara, like I said, Lamara will be a speaker today. I'm a lawyer by profession, but a lawyer with a very great passion for mental health rights. Yes, I'll be looking forward to delving into more discussions with you as we go on. Otherwise, thank you so much for this platform.
Edward.
Thank you, moderator. My name is Edward Liyombia. I am a chartered accountant by profession. I'm also a board member of this organization and a Rotarian. So I'm very happy to be here. Thank you so much, organizers, for making this happen. I wish you all the best. Thank you.
Free Mind Hive, I think that is Sarah. Sarah, can you introduce yourself?
Yes, I'm here, and my name is Sarah. Very passionate and excited about this day that is finally here. I envision a compassionate care in every sector and setting. So I'm ready to learn and relearn and perhaps also love. Yeah, thank you.
Thank you so much. We have Hilda.
Good morning, everyone. Hello, good morning. My name is Hilda Mugoya. I am a Rotarian, and I'm here to learn more about mental health.
Christopher Kato.
Yes, good morning, everyone here. Like you've heard, my name is Christopher Kato. I'm a nurse by profession. I work with Redeemed Medical Services in Kampala. Then also a director of KBC Medical Services. At the same time, a CEO of Sure Hands Africa. Yeah, basically that's how I can describe myself.
Thank you. Margaret.
Good morning, friends. Thank you, moderator. My name is Margaret Naimanye. I work as an accountant at Galaxy International School, Uganda. I am an active Rotarian, and I'm also a member of All Saints Chapel Weza, where I am part of the Compassion Ministry, and I'm a trained lay counselor. I believe all of us have mental health issues, but to a very degree. I'm here to learn more about mental health, to support myself and to support others, and also specifically to listen to Barbara Chan, who is a daughter to one of my smaller church groups, which I attend with her parents. Thank you so much.
Thank you so much, Margaret. We have Paul. Paul, can you introduce yourself? You've just joined. Maybe let me go to Penina and you come in after Penina. Penina, you can start. Dr. Penina? Oh, we can't hear anything, Doctor, and I see you have unmuted yourself.
Good morning, Edgar.
Good morning, Dr. Penina.
Yes, good morning, everyone. I'm Penny Gaba, a demographer, a lion, and a friend to Edgar and her family. Nice to listen in today.
Okay,
Thank you.
Paul, you can go ahead. Paul, can you unmute and introduce yourself?
Yes, good morning, everyone. I hope you're all doing well. My name is Paul Piroth, and I'm a friend of Mr. Eddie Gold and a friend to Sarah as well and her family. And
Thank you, Paul.
glad to be on.
Thank you, Paul. Can we have Fiona? Fiona Campereza, can you introduce yourself? Unmute and introduce yourself.
Hello, good morning, everyone. My name is Fiona Campereza, and I'm glad to be part of the group here. Thank you.
Okay, thank you so much. I think our moderator today is actually the chairperson of Free Mind Hive. And I think everyone has introduced themselves. Those one who will come in, maybe they will introduce themselves in the chat. I hand over to you for the day. Thank you.
Thank you for the wonderful introductions, everyone. You're most welcome. Now, for those who are joining Free Mind for the first time, we operate in the mental health segment in the health sector of the health sector, and this project or this organization, this outreach was born out of desire of the co-founders to share their lives, their life experiences, to impact other lives in creating mental health awareness and how fighting stigma and create hope for those grappling with mental health challenges and other related ones. And so you're welcome to this space, and we want to discuss pertinent issues on how we can extend this reach to other people who are not aware. There are people who have no idea that there are any mental health education that is needed, any mental health challenges going on. And we have almost everyone must get mental health. And so that's what we are here to do. And the essence of this webinar, we want to foster trauma aware community where we are going to equip and help people to realize what we are into and how to uphold the mental health rights. And we want to see how do we recognize signs of trauma. We want to also look at how do we implement effectively compassionate care strategies in everyday interactions. So we are going to see how we will be empowering caregivers, educators, community members with the knowledge, skills, practical tools needed to advance for mental health rights and to provide compassionate, trauma-informed care for children. Now that we have them in this holiday season, I think parents who have not been having very many children at home, now we are going to be having them like mine. Now they are all back home. So it is a cocktail of happiness, of breaking things, of climbing, and some of these things, maybe parents who have been waking up, kids go to school, now they are home full time for close to 2 months. So we want to see how do we extend this care? How do we get empowered to reach out to these people? We are not going to, I'm not going to waste or to expend more time in other things. I would like us straight to go to our people, our speakers who are going to talk to us. And our first speaker is Barbara. We'll be introducing her later. Our second is Helen, and our third is Derek. Each speaker has 20 minutes, and then we will have a Q&A at I think every speaker will be having maybe particular questions, but also to those that will be engaging us on how we can have a successful engagement. So our speaker, Barbara, is here, and we'll be inviting her shortly to come and speak to us so that we will start hearing on how to understand mental health rights and advocacy. Barbara Lamara is an advocate of the High Court of Uganda. She holds a master's in human rights and democratization in Africa from the University of Pretoria, South Africa. She's a holder of Bachelor of Laws degree from Makerere University, postgraduate diploma in legal practice from Lord Volment Center, postgraduate diploma in project planning and management from UMI, and she's passionate about awareness for children. She's passionate about international law, criminal justice, African human rights systems, disability rights, refugee projections, and transnational transitional justice. And she's a member of the Uganda Law Society, East African Law Society, a vice chairperson of the board of directors of NetPeel in Uganda. And Barbara, you're most welcome. You have 20 minutes, and we'll want to hear from you on how we can understand mental health rights and advocacy in the space that we are in now. Thank you, Barbara. You're most welcome. Please make Barbara welcome by giving those emojis on the page, on the reactions. You're most welcome, Barbara.
Thank you so much, Council Arthur. I've been trying to share my slide, but I don't think I can share. So I request the admin to kindly share the slides that I shared. Yeah. So I've already been introduced. Thank you so much for the warm welcome and the introduction. I'm very happy to. Yes?
Sorry to cut you short. I'm going to give you the hosting rights for a moment so that you can present.
Oh, okay. Yes. So as you do that, maybe I'll be saying a few remarks. Yes, thank you so much to Sarah, Mami Eddie Gold, and the entire team at Free Mind Hive for organizing this webinar. In a special way, I would like to recognize Auntie Maggie from All Saints Chapel Weather. I think I can see her somewhere among the participants. Thank you for joining, and thank you to all the listeners for joining. Yeah, I think I'm now the host. Okay, just a second.
But in case it continues to fail, you can give me the host, and I post. I do display for you.
Okay, just a second. I don't know if you're able to see.
Yes, we can see.
Yes, we can.
Okay, perfect. Okay, basically my journey with mental health advocacy started in 2020 when I was selected by a network of public interest lawyers to join an organization to demystify the Mental Health Act that was actually after the COVID aftermath. Yes, so one of the organizations was Free Mind Hive. I was instead posted to Mental Health Uganda, but I had the privilege of working with Council Godwin Toko, who was posted at Free Mind Hive, and we always shared best interests and, you know, advocated for mental health in that space. So without wasting time, since I only have 20 minutes and I have quite a lot to talk about, I'll go straight to the discussion. So mental rights are guaranteed under laws in Uganda. And it's important to note that Uganda is a state party to various international and regional human rights treaties that protect mental health rights. For the purpose of this webinar, we'll consider the Convention on the Rights of Persons with Disabilities and the Convention on the Rights of the that's at the international level. And at the regional level, that is the African level, we shall consider the protocol to the African Charter on Human and People's Rights on the Rights of Persons with Disabilities in Africa, and the African Charter on the Rights and Welfare of the Child. So it's important to note that the Convention on the Rights of Persons with Disabilities is the international treaty that protects rights of persons with disabilities. And of course, it provides for various rights that we'll later on look at the domestic level. And then, of course, we had to look at the Convention on the Rights of the Child because this focuses on the rights of children with psychosocial disabilities, among other disabilities. Why I listed the protocol to the African Charter on Human and People's Rights on the Rights of Persons with Disabilities in Africa is because it's actually a new treaty that came into force this year, that was in May. It had actually taken so long for so many African states to sign it into law. But recently, Uganda signed, and I think Uganda has that because they needed 15 signatories for it to become law. And Uganda was among the last to sign. I think the 14th to sign. That was last year in 2023. So this year, finally, in May, it became law. The treaty is not known so much. So there are supposed to also be efforts to raise awareness among African states about the treaty and all that. This treaty, unlike the Convention on the Rights of Persons with Disabilities, this treaty focuses on persons with disabilities from an African perspective. It addresses the unique needs of persons living with disabilities within Africa. And remember, when we look at disability within Africa, we see that there are so many challenges that people with various disabilities, including psychosocial disabilities, face in Africa, including stigma that may arise due to various African customs and myths, the harmful practices. We look at also the role of the family and caregivers because our communities it's a more of a communal community. So all those are addressed under the African Charter. Yes. All these have been domesticated also in Uganda. By domesticating, I mean these are at the global level. But then when we come to Uganda, we see that the Constitution of Uganda actually protects mental health rights. When you look at Article 21 of the Constitution, you see that it protects the right to equality under the law. That means everyone is equal under the law, regardless of gender, disability, regardless of race and all those other things that they list there. But key there is disability. So everyone is equal under the law. So that enshrines the principle of non-discrimination under the law. So that entails all human rights. It means everyone is equal under the law. So you have to enjoy all the rights that are enshrined under the law equally like any other citizen. So the other right that is relevant here is under Article 32. That is on affirmative action in favor of persons with disabilities. And under Article 35, rights of persons with disabilities are protected, and the article further mandates the parliament to make laws that protect the rights of persons with disabilities, including those with psychosocial disabilities. There are some other rights that I haven't mentioned under Chapter 4 of the Constitution, but like I said, Article 21 provides for the principle of non-discrimination. So it means all the rights that apply to everyone apply to mental health rights too. That is the right to life, freedom from torture, right to privacy, right to information, like we're later on going to see under the Mental Health Act. So, like I said earlier, Article 35 of the Constitution of the Republic of Uganda mandates Parliament to make laws that protect the rights of persons with disabilities, including those with psychosocial disabilities. So, under that mandate, Parliament enacted the Persons with Disabilities Act of 2020. It's a relatively new act. Recently, it was given a chapter number 115 of the laws of Uganda. So one special thing about the Persons with Disabilities Act, just a second, is that it's a progressive act. It's a progressive law that actually reiterates all the rights in the Convention on the Rights of Persons with Disabilities that we earlier on mentioned in a Ugandan law. Then specifically to mental health rights, we have the Mental Health Act. It's also a very progressive act. This Mental Health Act replaced the Mental Treatment Act that was quite backward and followed the medical mode of disability and was quite derogatory and all that. So the Mental Health Act is a 2019 act. That's the act we're trying to demystify in 2020 in that project where Free Mind Hive was involved. So it was recently given a chapter number, that's chapter 308 of the laws of Uganda. And if we are to delve more into the mental acts, the act is actually, if you compare with many acts in Uganda, sorry, in Africa. Recently, I've been doing a comparative study of various mental health acts in Africa. And our Mental Health Act actually fares well. It's of course not where we want it to really be, but it's good progress towards the right direction. So the Act has an entire part that talks about mental health rights. That's part 4 of the Act, from sections 51 to section 59. All those talk about mental health rights. Some of the key rights include respect for the person, human dignity, and privacy. These are very key rights in terms of psychosocial disabilities, because many persons with psychosocial disabilities experience violation of many of these rights that are listed here. For example, while trying to access treatment in many of the health units, if you go to many of the health units, for example, okay, let me not go into those details, but if you go to many health units, you'll find that many of these rights are violated, and many of the mental health practitioners also don't seem to be aware of these rights, despite the sensitizations that have been going on around these rights. But yes, we have respect for the person, human dignity, and privacy. These are very key. Freedom from torture. Freedom from torture is a non-derogable right. Freedom from torture, cruel, and inhumane treatment. Torture can also be emotional. It doesn't have to only be physical. Then we have the right to protection from physical, economic, social, sexual, and other forms of exploitation. So this is very key because very many people with disabilities experience a lot of exploitation. Physical, it's a very common occurrence. Economic, social, sexual, this happens quite often. And various other forms of exploitation, such as forced labor, and all those are actually prohibited under the Mental Health Act. Then, of course, freedom from discrimination, that is, it still goes back to equality under the law, freedom from exploitation and abuse, then the right to information. The right to information is very important because usually when persons with psychosocial disabilities access medical services, sometimes they are not given all the information they need regarding their treatment options or their health care plans and all that. And yet they're supposed to make they have a right to informed consent. So they're supposed to make informed consent to various treatment options that they are supposed to go through. This could actually be through an advanced directive, or that is making the directive prior to maybe when the need arises and all that. These are very key rights, and I've worked before at Mental Health Uganda, and I was in charge of a legal aid desk, and many of the cases that were reported by persons with mental health challenges were around this, including sexual abuse, economic abuse, violation of privacy. So these are very common, usually abused because many times people are not the rights, or they don't consider the rights in circumstances where they're supposed to consider. And yet human rights are actually inherent, and this applies to mental health rights, which are also human rights. So in terms of advocacy, these are very many options that I was trying to brainstorm. I know some have already been tried and tested by various mental health activists or civil society disability DPOs, and some may still be in the pipeline and all that, but then I found it useful to put more emphasis on them. So I started with the global level. At the global level, it's important for organizations to apply for observer status at the African Commission on Human and People's Rights or the African Committee of Experts on the Rights and Welfare of the Child. Something that is key maybe to put across now is that the African Committee of Experts on the Rights and Welfare of the Child recently started working groups. That is just a committee of experts that handle various issues that are pertinent human rights issues arising, especially in relation to the child. And one of the working groups is the working group on children with disabilities. Yes, so getting observer status allows us to voice our concerns at a global level, at a regional level, and helps us to network further with other organizations that are doing the same work with us, and also improves on our prospects for mental health advocacy. The other that I thought of was participating in shadow reporting. So many organizations have been participating in shadow reporting, especially shadow reporting on the Convention on the Rights of Persons with Disabilities. So that is basically writing a report. Usually the government submits a report, and then civil society can participate in writing a shadow report and sharing their experiences in light with how the government is actually taking the necessary steps to realize the rights that are enshrined in the treaty. For example, the Convention on the Rights of Persons with Disabilities in this context. Another is applying for grants to support mental health advocacy. So that entails fundraising and, of course, being on various platforms, especially at the global level, increases the capacity to attract more grants. Then we could also petition courts, especially if there is an issue that is it's pertinent to the mental health rights of citizens. For example, there is a provision in the penal code that criminalizes attempted suicide, and yet these are issues of mental health. So there is currently a case at the Constitutional Court of Uganda that we filed in an attempt to petition the Constitutional Court to declare that attempted suicide, criminalizing attempted suicide is actually unconstitutional, because when you look at the statistics, actually the global statistics, Uganda is one of the few countries that still criminalizes attempted suicide. Yet these are actually issues that can be settled through improving on mental health of citizens. Another is applying to court for redress in case of violation of mental health rights. We have the Human Rights Enforcement Act, of course, and of course we have the Constitution that provides for all these rights, and we have Article 50 that grants us, I would call it, permission to go to court in case any of these rights has been violated. You can actually apply to court for redress, and you get a remedy in case any of these rights have been violated. Those are the rights that we mentioned earlier. Then, of course, we can utilize platforms such as the Uganda Human Rights Commission. This is a national human rights institution that is responsible for the enforcement of human rights. Those are the human rights that are enshrined in the Constitution, and of course, all those include all the mental health rights that were actually mentioned earlier. The Uganda Human Rights Commission has actually awarded so many remedies to various people with psychosocial disabilities, and these some of the cases that I've actually handled, and we have actually received remedies through the Uganda Human Rights Commission. We could also engage the Ministry of Health and Ministry of Gender. These are the two key ministries in line with mental health rights. The Ministry of Health and Ministry of Gender have a key role that they play, and recently, that was in 2022 at the Global Disability Summit, there were some commitments that were made by the government, and the Ministry of Health is supposed to follow up on some of these, including drafting regulations to the Mental Health Act, because you realize that the Mental Health Act is already there, but then for it to be fully operational, we have to have mental health regulations. And like I said earlier, the Act was enacted in 2019, but this is now 2024, and we do not have regulations to the Act. So it's kind of preventing the full enforcement of the Act. And maybe to also mention this, we could also do advocacy for the mental health policy. We don't have a mental health policy as a country, and we also still have the strategic plan of the mental health division of the Ministry of Health still in draft form. So all those limit the clear picture for advocacy, because for us to be able to advocate, we also have to know the government priorities and what we can advocate for, and what the government plan looking like and all that. Then these are also additional. We can also utilize social media platforms. For example, recently, there are so many Twitter spaces. We could organize more Twitter spaces, and of course, share widely, develop informative materials such as fact sheets. Sometimes numbers seem to draw in more people. Like when you say maybe this in like, I've seen so many numbers, like maybe 1 in 4 people are likely to experience maybe a mental health challenge or something like that. It usually draws more attention to mental health. Then of course, utilizing coalitions and partnerships. This is a very good platform that we could build on. there are these mental health coalitions, so we could also utilize them more, maybe doing more work that puts us out there so that more people are able to know about the work that we do as mental health advocates. Then community outreaches in schools and places of worship, or maybe in Rotary fellowships or in various fellowships that we have, we could introduce a small component of mental health because it's a very key issue. And defining referral pathways and sharing widely. Many people do not know what to do in case they have someone suffering from a mental health challenge. They don't know where to take them. They don't know which numbers to call. So I think it's also key to share the referral pathways. And of course, host community events such as walks and runs. You could organize mental health runs, engage with local media, participating in advocacy campaigns, especially around now we have the World Disability Day coming up this December, on Mental Health Day, World International Mental Health Day, or the Mental Health Awareness Month. And another thing that I've actually seen that really works is establishing peer support groups. These are usually groups of people with a lived experience of mental health challenges. So these groups usually support new members and of course share their experiences, and these usually inspire other people who may be facing stigma and do not want to come up and talk about their mental health challenges. Then involving local leaders and village health teams in mental health work. I've been involved in training local leaders and village health teams, especially within Kampala and Wakiso, on mental health rights and the referral pathways, because usually these are the first point of contact when someone experiences a mental health challenge within the community. So since the village health teams are like the health center one, yes, that's what I would refer them to in our communities. It's very key that they are aware also of mental health rights and not just issues to do maybe with HIV and TB, but also mental health, because they usually interact a lot with members of the community. Otherwise, thank you so much for listening. I hope I've used my 20 minutes effectively. Yes, and just for emphasis, mental health is a human right, and yes, I think there are some people also in the waiting room. Yes. Yes.
Thank you. Thank you, our presenter.
Questions.
Thank you, our presenter, for the wonderful presentation. And as members, I believe we have been noting, especially areas of that need how we can reach out, how we can exercise these rights, how we can protect and observe them. I was really more interested on how we can get observer status, how we can also begin shadow reporting, and also to apply for grants. I think those are very good areas to increase our visibility and how we can actually get to those big spaces of ensuring that everyone is aware of these rights in our communities, in our country, and in our generation. Right now, we are going to have a short video that we are going to watch right now, and then we'll be inviting in our next speaker. Please, those with questions, kindly write them down or write them in the chat room. We are going to handle them at a later stage. Our technical person, kindly show our video.
Please, Barbara, share the hosting rights with me again.
Okay, I'm Juanita. Okay. Seems like I'm failing to do that.
Go to the chat room, click on my name, and then
Yes,
those were 3 buttons you see. You will see
that's
an
Alan,
option.
right?
Yes.
Okay. Yes, Alan. Yes, sorry. I don't know if it's reflecting on your end. Has it?
Thank you.
Yes, it
Okay,
has
thank you.
now.
It's good to see you. It's so great to be with everyone again.
Yeah, it is.
How have you been?
I'm not good.
It's good to see you. It's so great to be with everyone again.
Yeah, it is.
How have you been?
I'm not good. I haven't been good. The truth is, for a while now, I feel like I've been stuck in a dark place. I can't remember feeling happy. No one really hears me, you know? I'm good. Yeah, things are good.
That's great.
Arthur, you can go ahead and introduce the second speaker. That was just a short video on what people go through when they're experiencing challenges with their mental health. I hope it was insightful for everyone that was able to view it. Yeah, passing on the torch to Arthur.
Thank you, Alan. We always have a lot to learn, always. I want to take this pleasure to introduce our second speaker, who is already online. Our next speaker is Helen Mbabazi, who is a wellness coordinator at Minet Uganda Insurance Brokers Limited. He's a social worker and a workplace counselor who oversees the employee assistance program, working in collaboration with a network mental health expert, who is a network mental health expert to assess, educate, and manage risks of mental ill health as an approach ensuring corporate employee well-being. She's passionate about human capital well-being, development, and optimization. She spent the longest years of service in medical health industry, overseeing patient service satisfaction and health education program. Served in various positions with organizations to include Fanero Ministries International, International Air Ambulance, Healthcare, UN initiative, African AIDS Vaccine Partnership, UK-based international water dialogues, Uganda National Water Dialogues, International Hospital Kampala, Kalebu Limited, and among others. Currently, she's focused on contributing towards efforts to reverse trends of mental ill health impact on African human capital through normalizing the mental health conversations, providing psychotherapy, assessment, and support. Our speaker is here. Helen, you're most welcome. Please speak to us. We are eagerly waiting. You're welcome.
Thank you so much, Alan, for introducing me. Thank you so much for the program. I don't know whether it was intentional to put this video at such a time before I present. It was quite emotional, but I will survive. We are here to build our resilience. And as long as these things happen, we've got to find a way around it. And that's our goal, our optimal goal. If Ellen, you can allow me to share the presentation.
I hope you've received control.
See, yes. Please confirm as soon as you can. See?
Yes, we can see it now. Yes, we can see it.
Okay. I have a simple, I still have 20 minutes. Arthur, please help me do the timing.
Okay, let me start the timing.
Yes, please. Thank you. So I'm just briefly going to talk about recognizing the signs of trauma. But of course, I'll have the opportunity to start by introducing and sharing a few things that really happen around. Where I sit, I see adults who have been impacted. And so this conversation is so dear to me. And allow me to start by saying that, oh, sorry, Barbara, thank you so much for that highlight of the rights of mental health. You've exposed me quite deeply of things I didn't know. I'll probably get in touch with you to see how we can actually enhance this at the workspace, because we are having a lot of trouble having people to manage their mental health, leave alone even having permission to leave office, to have the confidentiality they need. This is something that we need to work alongside to see how we can support people. I'm very glad to meet you and to hear all that you've presented about mental health. Mental health, trauma is really part of mental health. We cannot disalign what this is in terms of the space it occupies in mental health. But allow me to just define trauma as an emotional response to an event that deeply affects people and causes a level of distress. It's deeply frightening and causes a level of distress. This happens when a person is so overwhelmed with emotions like fear that their mind can't even make sense of. It happens all of a sudden and you literally have no control over it. Trauma, of course, occurs when a child is when a child's ability to cope is overwhelmed. And when they get overwhelmed, of course, they're all over the place. They start showing such behaviors that sometimes in the African way, you think they're being stubborn, yet it's something that's overwhelming them from inside. Of course, exposure to one type of trauma can increase the risk. If a child has had trauma, of course, the subsequent one simply increase the child's risk of experiencing another kind of trauma, because everything starts becoming scary, even simple things. Now, these are some of the things I would like us to highlight, that while trauma occurs, when trauma occurs, trauma occurs when a child experiences, witnesses, or hears about threatening and dangerous situations. Now, these events can be isolated or occur in a series. but they impact the individual into adulthood. It never stops. As long as it's not dealt with, it will always come back in their adults. Right now, we see people, we are doing psychological safety training for leaders, but it's amazing the things we are finding out. People leading others when they have traumatic events that affect the way they lead others. And it comes out so negatively that the way they manage other people is literally affecting them psychologically and causing them mental ill health as well. So that's the danger that we are looking at. Trauma is a risk factor for nearly all behavioral health and disorders and substance use. Literally, if you find, again, mainly in girls, if you find an SUD, that is substance use disorder or alcohol use disorder, chances are high that they have a traumatic event. Most inclined to sexual when you find them abusing, but it's also very common to find this when you try to dig deep in what led to a young man or a woman to alcohol, to this magnitude or substance use. You realize there were traumatic events that happened either in their childhood or when they are old, but they are unable to really deal with them. And so they take to drinking in order to disguise or hide themselves. The experiences of chronic and complex, of course, there are levels of trauma, but the chronic and complex trauma in early in life has a very lasting impact on an individual's development and personality. As you all know, if a child before 7 years is forming in terms of personality, in terms of character, so when trauma finds them at these early ages, it's going to affect their development and, of course, their personality. For some of you who have diagnosed children with personality disorders. The critical part of a child's recovery, of course, is having supportive caregiving system. I've underlined caregiving system because the rest can only work with a very supportive caregiving. But I think I've had the previous speaker, knowledge becomes a very important thing. It's one thing to give care, it's another to have knowledge. So I'm going to talk about this a little later, but of course you need effective treatment. Sometimes there are drugs needed. Service systems that are really trauma informed are very important. The schools, every environment needs to be informed, which is what we don't find as something that is normal. The diagnosis for children's trauma is normally what we call CTS, child trauma stress, which is a term that describes the psychological and emotional responses a child may exhibit after experiencing or witnessing traumatic events. Now, of course, in kids, there's so many behaviors that we are seeing, especially for teachers who associate with kids a lot more. You're going to see different behaviors, and it's important for us to be able to understand the psychological, the emotional responses that are related to traumatic events, because they do have immediate effects. Later on, even when they grow, they do continue if we have not observed and dealt with them or managed them as caregivers. Children often lose their sense of safety, okay, or is intimidated by anything. They fear being left alone. They can't cope with people they are not used to. It becomes very difficult. You literally see that they are very uncomfortable, even when they can't say it. Their sense of security, which leads to various emotional, cognitive, and behavioral symptoms as from a child. In terms of now, there is an impact to trauma, of course. If it's not addressed, childhood trauma can have lasting impact on different aspects of life. Of course, the first one that you can take note is the relationship. Even while they're at home, the relationship at home are very difficult. To trust people is very difficult. The level of resentment also becomes high, but also the aspects of mental health. Okay, there are things that you cognitively can tell that they're not thinking right, they're not able to reason right on some things, they're not able to make some decisions, either early enough or late enough, or they keep judging themselves or keep forgetting. All these are some of the signs. And of course, the academic performance, because when they reach the school level, you realize that regardless what you have put in place for them, the academics are not picking up. And again, this causes them more trauma as well, And of course, depending on how the teachers, the fellow students treat the child, this might also increase the aspects of trauma in the child. There's a bit of struggle to trust, leading to inability to form and develop healthy connections. Usually the connections are unhealthy for a simple reason. They're looking for trust. They're looking for somebody to believe in them. And everybody says something that would literally take them back to their trauma experience because, of course, they are ignorant. They don't know how to behave or to respond. They think they're responding to a normal person. But in that, the child tends to lose connection with these people because at any one time, this person seems to be like one of those who caused the trauma on their lives. They have difficulties in staying focused, which impacts their schoolwork. Their future career is also affected somehow because they're staggered into a lot of thinking, inability to resonate, make decisions. And of course, childhood trauma can also manifest physically and increase the risk of cancer, diabetes, and other conditions in a child, meaning that the physical illness also comes in as well as a result of the trauma. Of course, the long-term impacts, individuals with early trauma histories may be at a higher risk of developing depression. Of course, where there is no care, that it becomes they're predisposed to depression, anxiety, and post-traumatic disorders. And of course, substance use, which I've already talked about. They experience difficulties with emotional regulation, impulse control, and forming secure attachments with others. Now, you can imagine that this is all in the long run, these become uncontrollable. And literally, these are people at an adult age who have families, they have their own children, and they're, because of their own trauma, the way they are managing their own children is coming from an experience where they are coming from. If they are leaders in an organization, this is also coming through as well. How they form, how they regulate their emotions at these places becomes very problematic. They are very impulsive, and you can imagine a person making decisions on behalf of others with all these long-term impact behavioral issues. Again, child trauma can profoundly impact the ability to form and maintain relationships. Trauma involving a trusted loved one, a caregiver, or a family member can shatter feelings of trust almost indefinitely. Trust, safety, security, meaning that the child is less likely to pursue connections with others later in life, of course. And of course, kids with trauma tend to trust, again, the wrong people, and the wrong people, again, impact them more, which causes a cycle that they almost fail to come out of. And this is partly because the people they are resonating with them do not know what happened in the past. It's only the children who can understand. That is, if they're able to even put a finger to what's going on in their life. It's unexplained because it happened when they were young. They can't put a hand to it. They can't explain why that happened, but all they know is that their life changes when certain things happen. Now, traumatic events may potentially include psychological, physical, sexual abuse. And allow me to say that the current sexual abuse in children were not necessarily somebody who has raped a child or done anything. But the sexual abuse we are seeing now is exposing kids to technology of people using pornography, using sex. It is. If you've experienced kids at the first sight of sexual habits, they're normally scared. Anybody who has had that, it's scary for a child. Now, I want you to imagine a child who is exposed to technology and is seeing all these things, cannot make sense of them, and they're right in their heads. This is one of the things that has caused a lot of traumatic experiences. And of course, some parents are trying to normalize sex. I understand that in places like Europe, sex is being normalized for children at an age of 3. You're going to realize a lot of traumatic events again here, because the brain of a child is not yet ready for this level of activity, let alone understand its meaning later on understand why it happens, and that's why at a young age it's literally abuse, because the child is not yet there. There are a lot of anomalies, there are a lot of misinterpretations of what sex is to the child, and so this potentially causes a lot of trauma in a child's head. And a lot of baggage to carry from a young age. Witnessing violence, this you know, and especially for parents. And I think we have suicidal ideation up to 21% in secondary schools in Uganda. One of the reasons among the many is that the kids have lost hope because of the conflicts between two parents, and especially parents who have reached points of violence. Like literally, it may not be physical violence, but violence in words, violence in the way that they're behaving in the home. Again, these things have exposed children to suicidal ideation, have exposed kids to mental ill health at a very young age, to anxiety, and some are having depression at a very young age. You realize that the level at which kids getting anxiety at a young age is way higher. That I think our youngest in Butabika was 8 years. Very, very surprising, but it is happening. Neglect, emotional abuse. And allow me to talk about neglect. Neglect is not necessarily a child who is abandoned by a mother out of carelessness, but today's neglect is where we have been so preoccupied with work that we hardly pay attention to the children. Children in the young age between 1 and 7, when they are growing, their communication can only be seen by their actions, by their minds, by their emotions. And it takes a very attentive mother to the child to recognize something that is different, either with the way they look or with the way their heart is pumping out of the normal. It changes. If you're a mother and you're close to a child, you can know that something is wrong with my child. But because the work world has observed us, has taken us so much, you can hardly get the feel of what your child is going through. In most cases, you give them what they want, and you think that you've taken care of their needs. And yet at that level, their needs are purely emotional because they are building character, they are developing. And so it's important for us to undergird that and to look at that point of neglect. And of course, emotional abuse, physical abuse, and sexual abuse. I've talked about that. Community and school violence, which happens, of course, again, kids exposed at an early age become violent at school, and it also exposes the other kids who probably could have been coming from normal homes. Sudden or violent loss of a loved one. We've had counseling for kids who lost their dad, and it has taken us more than a year trying to counsel them, bring them back to a normal. They literally lost, and their world was literally crushed. Okay. It's always important, and I know because the mother was working, she didn't have time, didn't know what to do, lost about a month or two to try and help them. By the time therapy came in, of course, there was a lot to really deal with. But this is what is actually happening. Any loss, sometimes kids keep playing, and parents never think that these kids actually know what's going on. But they're potentially being damaged from inside, which comes out as trauma later on. Refugee forced displacement, and I think people working in refugees, you understand how war has actually affected kids. Trauma, gunshots, killing people in their own sites, losing their own loved ones that they have been seeing and burying them. Not one, not two, but many of them has a traumatic impact on these kids. That's why in the North, we're really dealing a lot with these for most of the people who have grown up there. And of course, witnessing domestic violence. I've talked about this a little bit. Sometimes it's not even in your household, it's in the neighborhood. If the neighborhood is fond of these experiences, they're never good for a growing child. They present and leave a lot of damage if they're not well managed at that tender age. National disasters, terrorism, kids, of course, in countries like Israel, Iran, what's that place? Palestinians, those kids have a lot of trauma. commercial sex exploitation, which is also growing. Some people are producing kids, expose them to sex at a young age because they want them to begin their job at a very early age for them to make their money. Again, these are some of the traumatic events that may literally expose kids. Of course, we have military-based military family-related censors, which include deployment, parental loss. I've talked about sex. I've talked about physical and neglect. I've talked about that. But here they are talking about unintentional deprivation of basic needs. Okay, what are the basic needs of a child? They will vary between the ages. And if you've done some studies on child development, kids have different needs at different levels. While a baby simply needs your body, your warmth as part of those essentials, when they come to age 3, the needs also vary. And again, I won't go into those details, but those are basic needs that can cause a little bit of trauma when kids miss out on them. Serious accident, life-threatening illnesses, bullying is a type of trauma that involves repeated verbal and physical aggression by one person towards another. Again, this causes trauma in children. You've had children say, so and so has abused me, and they're literally crying. You need to manage that at that point in time, or when they come back from school and mention that, we need to manage that to avoid. Witnessing death, suicide, and murder are the most devastating. I have kids who witnessed this. They have never, you still have to manage, you still have to communicate, you still have to ask questions to know how they are feeling, to hear the stories from their side in order to know whether they are reversing the effect or it's still in there and it's still deep for you to be able to know what's happening. Kidnapping, the experience of being kidnapped or abducted by a stranger, somebody who you don't know. I would like to say that some of the things we do, like if you're desperate and you need to go maybe out and probably you want to leave the child with a neighbor and the child cries because you really need to go out, or you have a responsibility. Sometimes it's not even going out, you have a responsibility and you have to leave a child in a home and the child cries. These are some of the things. It would feel like kidnapping because you've left them in a home which is so strange to them. That's why you need to acclimatize children to homes where you can easily leave them than leaving them in a place they are crying out. Every time you're saying, we are going to auntie so-and-so, they cry, and they literally don't want to stay in that place. These are some of the things that will leave traumatic experiences in them. So we need to take care of that. Shootings, witnessing, or being involved in a shooting. The kids of this generation are lucky. For us, we had gunshots when we were growing up. These days, it's rare to hear gunshots. Once in a while we do, but it's kind of rare. But there are times when shooting would happen literally every month. And literally you would know people have been killed somewhere. And the stories are told. Hostage of a child, being in an unfamiliar place against their will. I've talked about this when I talked about leaving them with a neighborhood or aunties they don't like to stay with, often accompanied by violence and threats. Okay. Now, again, as I try to conclude, yes, thank you very much, Arthur. This is my last slide, I should say. These are just some of the signs that you cannot negate or neglect when you see in a child. Preschool, early school symptoms of trauma, okay? I think you can see there are many, I may not be able to read every detail, but regression in previous acquired skills, things like bedwetting, thumb sucking, these are some of the signs. Sleep disturbances or nightmares, excessive or persistent fear, that is continuous and explained from a child out of the blue is one of the things that you need to look out of. Look at intense distress and emotional reactions. As a reminder, try to make sure that you get the stories out of the kids. Difficulty in language, like I've said, there's some of the things that become very complex. I think the next speaker would be able to speak about that. The child's development would start with the cognitive behavior, but when a child has gone through trauma, it's the vice versa, okay? They start with their survival because they need to survive instead of starting with the cognitive. Again, that's an anomaly in a child. Excessive clinginess and avoidance of social interaction. flashback or intrusive thoughts about traumatic events and nightmares, difficulty in concentrating or paying attention in school. I think these are some of the things that are obvious that schools can easily show. Physical complaints, stomach aches, headaches, kids with a lot of ulcers. Again, these are mental health issues that you cannot negate, especially if you see that the frequency is becoming more than normal. Check them for mental health assessments or psychometric assessments to see what's happening. Changes in appetites, again, if the child has been having a normal appetite, this is one of those difficult ones. Now, allow me to just to talk about emotional mood swings and instability. Again, this is what we normally see from the workspace again, but these are things that you can see in a child. Children, normally we know that they're happy people. They are happy people unless something really goes wrong, because they don't have a lot of challenges. They don't have things that would worry them. They don't have school fees to think about. They have not probably been exposed to things that take you as an adult to think about where the world is going. So at any one time you realize that there are many things that are disturbing them, it's a cause for you to pay a little bit more attention to understand what is causing that. Sometimes it's normal because lately, because of exposure to technology, kids are also getting access to a lot of things their brains are unable to take on. But there are those where you're going to realize this is excessive, okay? Excessive fights, excessive withdrawal and isolation. These are, again, things that you need to look out for. Now, I may not complete every detail of here, but from Alan and from Arthur, I've seen the warnings and I've seen you preparing me to close this. Allow me to stop here and say thank you so much for allowing me share some of these signs for trauma in children and adolescents. Over to you, Mr. Arthur.
Thank you, Helen. Thank you for opening our eyes to the things that we see every day. Sometimes we are unable to recognize them because we don't know that they are actually signs or they are indicators for us to be aware and see how to either intervene or know how to treat someone. I will give a scenario. I have a very dear friend of mine. Actually, I was his best man. They were attacked at night by bandits. He was on the bed with the wife. They cut him in the head, in the neck, all his arms so badly. And I think it's now close to a year, but he does not sleep at night. And he does not sleep because every time he tries to close, he sees those guys coming to cut him again. And what is more worrying is that his workplace is not helping him. They have sent him letters that because now it's a year that he's absconding from work, he's still under medication, taking some medicines. And so sometimes they make him so weak, he forgets time, and his workplace, they're almost terminating him. So I met him yesterday, we were talking about this, but he realized it's a consequence of the trauma that he went through.
Yes.
And his workplace, it's a government office. They're saying you're not fit for public service. They have written him several letters warning him, threatening him. So it is even worrying him the more. So you see, those things are very near us, and it is important for us to know how to help, how intervene at every level. So we really thank you, and we have a lot of work to do to help our people, our communities, ourselves. Yeah.
Yes.
Thank you.
Thank you very much.
Yeah. Thank you very much. Our next speaker is, I think I've not seen him at the call. I don't know if he's here. Is Mr. Derek here? Maybe he's using another phone number. But if he's not yet here, I think I'm going to invite Eddie Gold to come and wrap this up for us as we entertain more questions. Please keep the questions flowing in the chat room so that when we begin questions, we'll go through all of them. You can even state where you want the question to go so that we can have our presenters respond to these as we move on. Eddie Gold, are you there? Since Derek is not yet here.
I'm there. I had a small glitch. Can I have the rights to show my screen?
Okay. Helen, you have to, okay, thank you. I think you have already given us the right. Thank
you. Yeah. So thank you so much, Arthur. Unfortunately, I can't tell what could have happened to our presenter for this session. But it's okay. I'll jump in and say something about the topic. We have heard from our previous speakers, we have heard about our mental health rights and advocacy. We heard from the just concluded speaker from signs of trauma and how to respond with care. And so now we are going to look at the practicability of fostering this compassionate and trauma-informed care. This is from what Arthur has just said. Definitely, it is lacking at the place of work of that gentleman, and no one is trying to understand or listen to him, and that is what is lacking in most of our homes. And even most of us, we are still growing to see how we can do that, because mental health, handling mental health is still quite new in our society. So I'm looking at compassionate care. What do we mean by compassionate care? Okay, I didn't put my video. Sorry. I don't know why it can't come on, but let me just continue. What is compassionate care? We are looking at it as an approach to healthcare that prioritizes. It can be either healthcare, it can be even the way we behave in society, it can be, the way we treat those people around us, that prioritizes empathy, kindness, and understanding in the delivery of care. And the care we are talking about is not only in hospitals, but even in the home, in schools, in every society and community. It involves providing care that is not only competent and effective, but also caring, supportive, and respectful of individuals' dignity, autonomy, and unique experiences. When someone cares, you really feel the radiation. Someone doesn't have to say, I care for you. It comes from the words, from the actions, from the way the person approaches you. So we have to be compassionate. We have several steps that we can take to be compassionate. One, we have to be empathetic. Here we have to try and understand the feeling of others and share with them. It is quite difficult. I'm talking about it, but I know I'm still growing in this area also. It is not a given. We have to really, really learn. We have to practice it. We have to treat our colleagues with kindness. And this is a genuine concern for the well-being and comfort of others. You don't have to say, I am kind, but the way you do it, it's like, and those who read the Bible, it says it's by their fruits shall we know them, not by the clothes they wear. So it's the way that it comes out from you. We have to be respectful, valuing and honoring individuals' autonomy, dignity, and unique experiences when we are dealing with each other. We have to actively listen in We have to be fully engaging with individuals when someone is talking to you, and there has to you have to maintain eye contact and providing verbal and non-verbal cues. We have to learn not to be judgmental, the non-judgmental attitude. We have to avoid criticism. We have to avoid blame or judgment, and instead, of course, we focus on support and empowerment. So like this individual again that Arthur has talked about, all he needs is support and empowerment, and this can even quicken the healing. But now with all those letters that he's getting, they are really pushing him into the abyss that we might not be able to get him up. So there is a need of people to really understand. There is a need to have this holistic care addressing individuals' physical, emotional, social, and spiritual needs. Now they are looking at this this person in terms of working, but there are other needs that the person really needs. So there has to be that holistic care. In our last webinar, we talked about mental health in a workplace. But people really, when you talk about it, people think they know, but they actually don't know. Even when I know there are laws and regulations where they say when a person is sick for 3 months, you have to terminate. But how do you terminate? The way you do it, the way you take an individual through that process also matters. But here it's like they're raining on him with such letters and all that that is not really helping in his situation. We also have to be culturally sensitive. We provide care that is sensitive to individuals' culture. So when you're dealing with a person, you have to really, really understand. We are quick to judge. We are quick to point out what people do without even understanding their culture. Recently, I was looking at a certain wedding, and I think culturally, there's what the mother needed to do. And people who didn't know, they started really criticizing that. And yet, that is their culture. So we need to really understand the individuals we are in. So we have also to understand, we've been talked about, I mean, the previous speaker has really dwelled deep into trauma. So we need to have also trauma-informed care. And how do we do it? Through safety and trust. Under safety and trust, we have physical safety, ensure the environment is comfortable, calm, and free of triggers. It's quite difficult. Then we also have to have emotional safety. We have to try, whether one has mental health challenge or not, we have to be really, really be cognizant of providing emotional safety. We establish a sense of emotional safety by being empathetic, which I said in the first slide, non-judgmental, and we have to be genuine. We have also to be consistent and predictable, where we have to establish routines and clear expectations to promote that sense of control and stability. We have to be transparent and open and have open communication. Communication matters because every time there is misinterpretation of communication, you find that someone is it triggers somebody. So we have to foster trust by being transparent, approachable, and responsive to individuals' needs and concerns. Again, under the principles of trauma-informed care, there is choice and control. There's choice and control. And what we have to look at choice and control, there's autonomy and decision making. Here we empower individuals to make choices and decisions about their care and treatment. Many times we want to make decisions for these people. We put restrictions for someone who is not feeling well. I have also come to learn. I remember one time my daughter was telling that, "Mommy, you are taking away my power because you are not allowing me to make a decision." And so we have also come from far to learn. So we have to some sit, what what would make you happy? What do you want? And when there is something that at least we explain the reasons, then she's able to understand and she say, okay, now at least I've taken my own decisions. Then there is options and alternatives. When we say don't do this, we shouldn't let it at that. We have to provide options and alternatives to promote that sense of control and urgency. Of course, we have to create awareness. Education and information is very, very, very important. We have to educate individuals about their options, rights, and responsibilities, promote informed decision making. And that's why we had to start with someone who had to deal with rights so that we are all aware of the rights that we have. Then respect for boundaries. There have to be some boundaries drawn. If someone doesn't want to talk at that point in time, please let them be. If someone wants to sing, let them be. So with respecting the individual's boundaries and decisions, even if they differ from our own, we have to try and do that. As I said, I'm growing in this area. It's quite difficult. Whatever I'm saying here is not that it's a given. We have to practice it. We have to try our level best to see what is good. And there has to be collaboration and empowerment. When we are dealing with each other, there has to be that partnership and mutual respect. Sometimes my daughter tells me and says, I thought we were a team. And it looks like at some point in time, that partnership, fades away. So one has to rediscover and, try to get back online. So we foster collaborative relationship built on mutual respect, trust, and open communication. Then we have empowerment and self-advocacy. We have to empower individuals to advocate for themselves and take active role in their care and treatment. And again, that's why we came in with the rights. Even when we go to see the doctor, it's not. And I want to tell you that, by the way, forgive the doctors. They really don't know. They really don't know. Until you are in it, you will never get to know. It will stay on the book and theory. That's where we visited a doctor and said, I want you to submit to me. I want you to listen to me. I want you to do whatever I say. So it was like taking away the power from the patient. And that is not good, because that one makes the patient feel or the person feel very useless, powerless. And so we have to empower individuals to advocate for themselves and take active role in their care and treatment. We also have what we call strength-based approach. Let's focus on individual strengths, resilience, and coping skills to promote empowerment and hope. It's not only the bad part of it. I was talking to someone who was telling me the challenges that they have, and the person, one of them doesn't talk. It's just stays in the sitting room, and time for sleeping, the person doesn't go to sleep. But sometimes, so I was saying, no, look at the other good things the person does. Start from that. Appreciate those little things. With time, the person will know that I'm needed, I am felt, I'm heard. My daughter normally tells me that, Mommy, sometimes I feel not heard. And it is difficult because I feel that I'm doing my best. But then we sit and say, okay, how were you not heard? Then we go through it, and at some point in time, we get to understand each other, and the moods lighten up. Maybe those who are new here, we have lived experience with my daughter, and that's why we are really here trying to show that this is not easy, but with our commitment, with the God on our side, things get easier and easier. But when they are not easy, then we don't give up. We have our motto that don't give up. When even she's in too much pain, and you ask her, what is your motto? She'll tell you that not to give up. Even when she has no strength to speak, she'll be able to say it. So we have our motto. She doesn't give up, I don't give up on her. So that is our motto. In whatever we go through, we can't give up. And then we need family and community involvement. there is still a challenge with people shunning mental health challenges or people with mental health challenges. You find that they want to leave them in the home. They want to, the people still tie them, lock them up. There's a lot that is happening out there. And that's why we came up with someone who understands the rights, that if you know someone somewhere who is not, who is being mistreated because of who they are, we pray that you find out how to report that so that these people can be taken care of. So family and community must be involved. Involve family and community members in the care and treatment process with the individual's consent, definitely. Sometimes, but sometimes we take decisions when individuals are not consenting, depending on the mental capability at the point at the point in time where someone you find that they can't maybe make a decision. But that one, when you are a family, when you have been together in that, you'll be able to understand when to step in and help the person to think. Okay, what do I say? We have our takeaways in fostering compassionate care and trauma-informed care is to create a safe space, ensure physical and emotional safety, then establish boundaries, have clear communication and respect for personal space. I know, as I said, we have lived experience. My daughter can say, "I know I'm not here. I don't want to talk," and then we let her be, and then she comes back and calls, and then you don't force things. You establish boundaries and you respect them, and we have to use trauma-sensitive language because sometimes the words we use trigger people. So we have to avoid triggering language and focus on strength. We also have to focus on empowerment. That's why I said we promote autonomy, choice, and control, and also provide education and resources. And at Free Mind Hive, we are still growing, but we have our website where we are trying to put all these resources. We have a community that we have. If you're on Telegram, please join us. I'm going to ask Alan at the end of this presentation to tell us how to join our Telegram community, where people can ask questions and we answer, we share experiences. We always have like a monthly, what do you call them? Monthly, like a monthly motivational clauses or write-ups where we have to share experience again. So I would ask Alan to tell us how to join the Telegram community as we finalize the development of our website, where we shall also have a community to do the discussions. With that, I will say thank you for listening in. Thank you for attending, and we pray that you'll get something out of this. And yes, as Arthur said, write all your questions, and then our moderator will take you through. Again, I want to tell you that we have Arthur is our board chair at Free Mind Hive, in addition of what he does, and we have I think we have Edward Riyomba, who is our board member. I'm not so sure whether the others are online. If we see them, we shall also interview them. I think Sarah wants to add something maybe to what I have said. I see her hand up. Over to you, Sarah. Hello?
Hello. I'm lying down. I'm in bed. I don't have anything to say about what you have said. I'm very proud of you, Mother. She has put this presentation in less than 30 minutes. I am so proud you brought it out well. I'm just very proud of you. Yes, so she just hold on a bit. She had come to tell me to speak, but I want her to hear these words again. Mother, I'm so very proud of you. You had less than 30 minutes to put this presentation. Actually, at some point, I almost told her, why don't we just leave it? Then she was like, no, let me try. And mother, you have more than tried, you've done well. But my question goes on to Dr. and I'm not sure if she's a Dr. Barbara. Before I say that question, I'd like to also affirm something Minsa Helen said. Somehow, I've come to understand it that because when you're young and you suffer traumatic experiences, you somehow get the thought that there must be good people out there. So you easily trust. I used to wonder, why do I easily trust people? But just understanding that it's a trauma response that I'm easily trusting, because deep down in my mind, I think there must be good people that don't want to hurt me. But my question goes to Madame Barbara. In the Mental Health Act, peer support is not recognized as a mental health professional. What kind of steps can we take to see that peer support is recognized and valued, so that we can start operating legally in our nation? Thank you.
So over to you, moderator, to moderate the next session. Thank you so much for listening to us. And we
Thank
have
you.
that question here.
Thank you, our discussants. Thank you, members, for this wonderful expose that we have had about mental health. Sarah, you have asked a very pertinent question, and I think it goes to Barbara. If you can kindly, Barbara, if you can kindly attempt to answer that. What steps do we need to take to make peer support recognized and valued in our laws, and where do we start from?
Thank you so much, Council Arthur. It's been a pleasure listening to all the presenters. Thank you, Sarah, for that question. It's always inspiring hearing from you. You raised a very good question. Peer support may not be expressly mentioned in the Act, but when you read various human rights instruments, those are the treaties, you find that there is something on the right to live in the community, especially in the Convention on the Rights of Persons with Disabilities, that's a CRPD, and the African Disability Protocol that has just come into force. It recognizes the right to live in the community. And the right to live in the community, of course, entails freedom of association, which is also enshrined in our constitution. You're free to form groups and associate freely. And I think this takes us back to community mental health care, where persons with mental health challenges also live in the community, form groups together, and can access the services within that community where they live. Yes, I think it's not expressly stated in the Mental Health Act, but it can be inferred from the Constitution, that is the right to freedom of association under Article 29, and also from the human rights treaties that I mentioned earlier. I don't know if that answers that. And maybe one thing that I could mention is that we are developing a community mental health model. It's a consultancy that I'm working with Dr. Patricia Tim. She's also into the mental health space, and Professor Ben Mugisha, yes. We are developing community mental health model together with the Ministry of Health. And these are pertinent issues that have to come out in the community mental health model. Yes, the right to peer support groups. Yes, I hope that answers the question.
Yeah,
I hope I was being
think,
heard. Yes.
yes, you have been. I think also adding on that is if we could start writing position papers, and then we can trigger a policy to be made that will later on lead to the act being either amended. Also, other avenues is trying to do lobbying on parliamentarians to create space for it to be involved. But we must have a strong write-up on why we think it is important to be in the law. But I think the best place is to begin writing, then lobby for a policy, and then later on to have a draft presented to those committees at Parliament for it to be included into the amendment of the Act.
Yes.
Okay, thank you. Any other person with a question or a supplement on that? Let's have the questions to our presenters.
I saw a question, Chairperson. There was a question to me, I think. Can I respond now?
Yes, please. This is the time.
Okay. There was a question on how to spot the signs of trauma and respond with care. Definitely, there is no one way or one direct way or single way of spotting signs of trauma. But again, I come back to a person who knows their child and can observe changes as they happen. It goes back to how close we are to the children to even know what's happening differently. There are behavioral changes that will happen. Maybe more tantrums this time. Maybe isolating themselves all the time. Clinging all the time, fear. And of course, there's a lot of withdrawal that happens. But sleep is the other thing. When they sleep, they start fearing to sleep in their bed. They would like to sleep with you, or don't leave me in the sitting room, or mommy, where are you going all the time? Now, when you start hearing these, you start probably watching and to get a sense of what is really happening. And of course, the first approach is to get this conversation out. When the child is still young, it's easier for you to connect to their heart and understand what happened. Sometimes they don't have an interpretation. They may not have the language, but you start getting as close to them in order for them to bring out the conversation. But also each time you see the sign, you start bringing out, asking them the question, what happened, getting close, helps you to be able to know what exactly happened. Now, where of course it's something that they're unable to explain, especially when they're 3 years and below, you might need a child psychologist to try and help you get the assessment, especially when they can't talk well, they don't have the language to explain what happened. You might need experts to try and help you. But as part of your first aid is really to get close to your own child. If you can get the conversation out by yourself, you can literally go through what Mother Eddie Gold has explained to try and help them recover. The sooner for trauma, the better. I'm happy that that most cases, actually, most people recover from trauma. And the reactions, they go on reducing every time. That is because there is care around. the way people respond is really understanding this as a traumatic event. The challenges have happened that most of the people we are talking about are so ignorant. And I think it's again, I don't know if it's Arthur who said, people are ignorant about mental health, even in a workspace. They can't tell the difference between insubordination and somebody really struggling. Because they are adults, the only interpretation we have is people are insubordinating or they don't want to work. So our creating awareness about these things and how they manifest becomes a very important component on how we deal with them. Allow me, because I carry the spiritual perspective, is that sometimes some of these things are so difficult. There is now a growing thin line between you understanding what is happening and what is really true in what is happening. There's a lot of trouble going around that can easily cause trauma to any child now. It's no longer that you can keep your child secluded from the environment. Everything is out in the air. If it's not on news, on TV, it's on the video they are playing with. So there's a lot of exposure. But what we need to do is to understand the role of our spiritual life and our God in helping us tell the tale. What is happening to my child? What is this I'm seeing? In there, with your connection to God, you can get a lot of interpretation, but also you get responses on how to respond to the child. Is it time for me to pray? Is it time for me to talk to the child? Is it time for me to bring in an expert? Is all something that you can get an interpretation of, provided you have a close spiritual life with something speaking into you. I've had an opportunity to understand this, that every mother is a creative faculty and is able to reverse the course of what they have created. Because it comes from you, you can tell. I've been privy to times when mothers would say, I can know when my child is sick. I feel it in the stomach, meaning there's a connection between you and the child. There are things you can feel and tell that this is going on, and you can check at the right time. So I believe if we connect to that, it can continue to help us get the right care, probably in a timely manner, when something can actually change, because trauma is a mental issue. When it gets into the brain, it just gets locked in there. And all your effort is trying to unlock it such that your child can take in what can be able to address the fear. Okay. Fear is something that is really evil. It's not something of God. Fear comes as a result of you not understanding the love that you have around you, and you're trying to secure it from external things, or to think that the external world can give it to you. The moment you understand the love, your security, happens. If you've had a child, and I think Mother Eddie Gold can tell us from experience, the time that assurance comes to the daughter, that their safety happens freely, just like that. The moment it disappears, there's an insecurity that happens. Mother, are you happy? Have I done something wrong? The insecurities start coming. So it's something that we need to borrow from inside, because it's also possible to reverse this course. It's possible to improve. It's possible to recover and restore this, even from the early stages, which is the most important thing. Yes, I hope I've responded to that question. Over to you, our chairman.
Thank you very much, Helen, for that wonderful explanation. Members, if you have a question, please raise up your hand or shoot up straight so that we can conclude our webinar. Otherwise, we thank you for your time and being here. Any other person with a question?
It looks there's no one putting up their hands, just maybe to thank them. I want to thank Dr. Okay. I was going to say I want to thank Dr. Bikesha, who normally joins us from very far. Yes, Chair, over to you. Sarah's hand is up.
Yes, Sarah, shoot straight.
Okay. So I think let me sit up for this one. I wanted to maybe just highlight something that Mother said when it comes to empathy. And in the last webinar, someone also had a question on what does empowering language look like? Or what does empathy even look like? Maybe I can just share something small that empathy, one, as mother said, you're trying to be in someone's shoes, but two, you mention what you see, what you hear them say. Because sometimes, like, for example, if I'm telling mommy that, mommy, right now I feel so down, I feel inadequate, I feel like I've let everyone down. If she hurried to tell me, no, you've not let anyone down, she has not hurt me. But if she stops and then she begins and she says, okay, I can see how you doing that may make you feel you've let everyone down. I do hear that you're overwhelmed. So if we use the senses, sight, hear, or feel, to affirm someone, to affirm our children. Like, let me give you one more example. I had that it can be at the end of the day, a child maybe doesn't want to sleep, they still want to play, and you switch off the lights and they're shouting, oh, there's a monster, there's a monster. Now, humanly, and as an adult, you know there's no monster. So if you come to them and you tell them, but there's no monster, what have you just done? Made them feel foolish, made them not be heard. But if you come and touch on their back and say, oh, I'm so sorry, it must be hard to fall asleep when there is a monster. There you've opened up that conversation that even Minister Helen was saying. So not quickly shutting down, but learning the language of empathy, and maybe tell the child, let us look for the monster together. Switch on the lights. They check the part of the solution. Instead of just putting them down. So empathy is an art. I'm also still learning to grow in it. But empathy is the root of our compassionate care. And as Mr. Helen said, the most compassion, the father of all compassion is God. So as we go through all this with our children at home, where we feel we need help to be compassionate, we can easily just pray and say, God, help me with this child, how I can be compassionate. Thank you.
Thank you very much, Sarah, for that. Like you said, we are all learning. When you're talking about that, the true African parent, they don't negotiate. They don't, when they say sleep and you say there's a monster, the next thing is get a sleeper and they are beating you to sleep. That's the true African. And so too, we also have a lot of cultural adjustments that we have to make. A lot of them actually parenting, most of us stumbled into parenting, and the only way we know how to parent is how we are parented. So you're just seeing what your parents did, It's what you're doing, thinking it is the right thing to do. And so there is a lot of learning at all levels. When we are counseling people to marriage, we only counsel them to marriage. Most of the time, we don't tell them what they are going to meet, how they are going to be parents. And in the first year, they are parents, they have no experience. Most of them are even children themselves. They need to be parented. And I think that's where all this is coming from. So we have a lot of work, cultural adjustments, change of what we are seeing, how to communicate, how not to use a language that is going to trigger someone's trauma. So there's a lot of learning that we have to do, that to be able to be compassionate caregivers. So it's really good to hear this coming through. Let's continue learning. There's someone else who had raised up their hand.
Yes, Dr. Dennis Wikesha.
Yeah, thank you so much, Chair, and thank you, everyone. Eddie God. I have a very good learning moment. I speak from perspective of a parent, yes, perspective of...
Sorry, can you briefly introduce yourself? You were not around when we introduced each other.
Yes, I came late. Yeah, my name is Dennis Bichesha, as it might be appearing on the screen. I teach at the University of Rwanda, and I teach in the School of Law. But I also have met this family of Eddie God, Sarah, and the rest in Rwanda when they were working there. And we were going to the same church. In fact, Eddie God, for those who do not know, she was the chairperson of the community that was praying in English. And by that time, I was deputizing her. But I also have another bond with this family and through Eddie God, because Eddie God sits on an organization which I co-founded and is called Lead for Tomorrow, Rwanda. And among the projects we have positive parenting. And what we are talking, I see it very much aligned to positive parenting. Like Arthur, which you have mentioned, we are talking of parenting, and there are things maybe we should be emphasizing. Sarah is talking about, she's talking about empathy, she's talking about sharing many things, especially when there is fear with our children, not shutting them down. But the main issue that is happening, especially in cities, is we don't have enough time with our children. So you are talking of shutting down your child, maybe because you have even that time with your child. But there are people who wake up very early in the morning, they go to their offices when the kids probably, they are not yet up, or they are also busy, there is no room for conversation. They go back to their homes very late, and they find probably kids have slept. We have left our kids with maids, like the experience we have in Rwanda, and maybe I suspect in most Kampala families or Uganda in general. So this is, I think, also something we have to consider very important, that much as we may help our kids, but we should help them first creating time with them. That is one, but we also create time, of course, as Sarah has mentioned, and we do positive things with them, because again, we cannot have time to just frighten them in what they are doing. So we have another opportunity to create friendship with them. We have been doing some work in Rwanda, and we have been engaging women, mothers, in positive parenting. They give us very good experiences out of when they engage with their children. And they can also be in a position to help them not go under these, frightening circumstances. One of the things, again, that is causing maybe like these, I could say, we are calling them, let's say, monster, like Sarah said. I also had an experience with my kid. Sometime could call us in the night, but I came to understand that maybe when we are also leaving our kids to watch TV, we can watch TV. These days, there are other gadgets, even on computer, even on phone. They are watching things without, screening what is the best for them, what their brain can easily digest, and so forth. So sometimes what they are watching during the day may appear in their minds, and if we don't help them, again, they can get much more frightened. The other things that are maybe causing also harm to our children, I would say, is also the children we have can even test on things that are not supposed to test, like drugs and so forth. So there is a lot that we should learn from, like experiences, live experiences from Edgar, Sarah, and the rest. But we should also consider, very important, this activity that is coming through Free Mind Hive. I do not know, I'm still learning, but it should be something that has to be. I was looking at who is listening to this beautiful and important message. I counted as many as 16 attendants, but we should get like maybe bigger audience more than this. I don't know how we can do this. Maybe does it require a conference? Does it require something where we can have like 1,000? This is what came to my mind, where we can have like 1,000 or 500 participants to get a message from this powerful experience. Thank you so much.
Wow, thank you, Doctor, for this wonderful to reflect on this and hearing the establishments that are running forth on helping families, helping children, helping parents. We all need help. The children need help, but also the parents need help. Everyone needs help, and so it's we are a community that needs help, and so it's important for us to be in these spaces. And I think, like you're saying, how do we get everyone involved? Unfortunately, is that most people think they don't need help. That's where actually the biggest crisis is. That's where when there is such a webinar, they feel, that's not mine. And that's where the crisis is, not to know that you actually need help when you're in dire need of help. And so the clarion call goes beyond those who are aware, but there are those who are unaware that they need help. So you see, the catchment is so wide. So we have a lot of work to do, but we know God, who has opened these avenues, this platform for us, will be able to get there. Like they say in the African sayings, that the best way to eat an elephant is eat one piece at a time. So let's take this journey, know that we have to take bold steps towards making everyone aware of who they are, of their mind, of their mental health, and one person at a time will be able to reach the entire community. We thank you. Are there other people with questions? I see our time is running out.
Yes, we have Margaret.
Okay, Margaret, please, if you could take.
Thank you so much, our moderator. I just wanted to add my voice onto how much we need to get close to our children and be in their lives in order to support them. And we should not shun away from introducing some of these dangerous topics, such as the exposure to sex and images and communities or friends that may introduce them to those type of things that are unhealthy to them. We should not shun away from doing that, because it's better that you talk to your child before they are exposed to these things through other sources. Just as an example, I can share an experience that as a family we went through when my youngest child, who is now 13, was 8. He at school, through sports activities, because he's heavily involved in sports, so through those associations with older boys in sports, he got exposed to some of the things that the older boys were sharing on their phones. Now, incidentally, his elder sister was monitoring his social media accounts. We must monitor our children's social media accounts, especially when they're at a younger age. So as the sister was monitoring his social media accounts, she fell upon some of these things. So at the age of 8, we were able to sit our child down, and actually he was extremely traumatized by these images and things that were being shared, but he was saying nothing to anyone. So we were able to intervene, and as we speak, he was at that point coached and immunized against all this. Now, if he sees any such things coming through on his phone, he will share and he will run a mile from all these things. So we need to be in our children's lives. We need to know what's going on their phones, and we need to be bold enough to sit them down and talk to them and protect them against some of these things before these things destroy them. I think that's it. There's something else I wanted to say, but I've forgotten. But that's the main thing that I wanted to share. Thank you so much.
Thank you very much. I want to thank every one of us that has created time to be here for this discussion in a very specific way. I want to appreciate our first presenter, Barbara. Thank you for helping us appreciate the rights and advocacy and what we have to do in the legal regime. And we really appreciate your time, the sacrifice, and the ability to help us know these things. We also want to appreciate Helen for your time and expertise and sharing with us knowledge on how we can recognize signs of trauma in our families, in our children, in our communities, and how we can be of help. And we also want to appreciate our very own Eddie Gold for being hijacked to create presentation in 20 minutes. Really, it shows the readiness and how much has been invested in you. Really, you were speaking from the heart. There is someone who said that a man with an experience is never at a match with a man with a theory. So the experiences that have been exposed to you have made you a master of these things. And I think God has given you a particular office on how to help more communities and the people. in these spaces that we're talking about. Those that have given us your questions, those that have contributed, those that have created time to be here, we appreciate you. And we know this is just the beginning of great things. Let's continue the discussion. Let's not give up. Let's continue to identify. Let's educate ourselves, because when we are informed, then we'll be able to extend help at those levels. Normally, I have seen this happen in planes. They say before you put on the safety, the life jacket, before you help someone, your neighbor, first help yourself. Ensure that your life jacket is on in case of an emergency, then try to help a neighbor. And I think this is the scenario. We might be going through these traumas, some of these things, when we are not aware. So being exposed to this, you can identify a pattern, or someone can say, we talked about this and I'm seeing these patterns in you. You might need to pay attention to this. And we also change the communication with our children, with our spouses, with the people around us. We are learning, and I believe we are becoming able ministers to be able to reach out to so many. I want to thank you. And I don't know whether, Eddie Gold, you have something to add on. I would ask that we pray and then we conclude our webinar. I thank you.
Thank you so much, Mr. Moderator, Mr. Chair, our Asa Ayorechide. We thank you for moderating this session. I can see it has gone about 20 minutes past, but I would like to call upon Alan to tell us how to join our community on Telegram, where we ask daily questions, where we can get some daily nuggets regarding our well-being, our mental focus and all. Alan?
Hi everyone, my name is Alan Banjirana. I introduced myself at the beginning, but those that came in late or joined us late, I'm a friend to the family of Eddie Gold, and you could say one of the people that helped start or helped Sarah and Mama build this idea of what Pre-Mind Hive is. Anyway, to cut it short, I would like to share a link with you to our Telegram group. And basically, what is that in a nutshell? For those who have used WhatsApp, it's the same as Telegram. But the reason why we chose Telegram over WhatsApp, here are some of the reasons, in case some of you are wondering why we decided to have our community based on Telegram. One, it offers more features than what WhatsApp is offering currently. The capability to have different sections of groups, and also to create sections that are catered for people that are going to be helping out those that have specific issues that they need to deal with. But basically, the Telegram platform offers more capability for us, and that is why we chose it. And also the security and a few other good things. So in case you'd want to join our group, and would like to find out more information on how we can help you, we get to share informative blogs and content in it. In case you need help and you need someone to visit your family, to talk to, you have challenges, anything, you can reach out to us in that group. Of course, it's continuously evolving. A lot of changes will happen across this year until the next, but we're glad to grow with everybody that is here to help us create an informed community that understands what mental health is and help build a safer and more inclusive environment for Ugandans and the world at large. So in case you wish to join our group, the link has been shared in the chat room. All you need is to install Telegram on your phone. Install it, it's just like WhatsApp. Click on that link and you will automatically be added to that group. But before I end this conversation, a few pointers to those that are going to be downloading Telegram. And this is just an honest review. I've been on that platform for more than 8 years now. And these are some few things you should watch out for. In case you have children that you want to be added to that group, I would suggest that you do it using you as an adult in that account. One, the reason why is because Telegram has become like a dark web. People sell weapons, drugs, there's prostitution. There's a lot of things that happen on Telegram because it has given the capability to people to remain anonymous. It gives you so many things when it comes to security. If people are campaigning for human rights against a dictative government or regime, it's one of the platforms people use because it is safe, it keeps people anonymous. So when you create or download the app, ensure that you look at the privacy settings in that app. It gives you a capability to hide your name, hide your phone number, to make to go as far as making sure nobody's hiding you to certain groups, or scammers or any people with bad intentions are not contacting you directly. So all those settings are within Telegram, and you can access them for your own privacy and for your security. So to end that is all I can add on to that. The link to join the group has been shared. And again, I would like to re-echo to all the members that have joined. In case you joined late, there was a pre-assessment survey that we had sent out in the group, in the chat, sorry. And then at the end, we have a post-assessment survey. After we end this session, please fill it in because it will help inform us on which areas we need to improve on, where we didn't do well or where we have succeeded, and how best to make these webinars more informative, and probably, as the gentleman earlier said, to encompass and have even a broader audience attend, since these are very pertinent topics to discuss in our society today. Thank you so much, Ms. Edgord, for this opportunity. Touch back to you.
Thank you very much. I'm going to ask Crispa, are you in a position to pray for us? Are you in a position to?
Yes, please.
Okay, Crispa is my wife, and she's a trained counselor and psychologist. So Crispa, please pray for us. Thank you.
Dear Lord, we thank you so much for the great Lord that you are. Thank you for this great opportunity that you've given to each one of us, Lord. We thank you, King of Kings, for keeping us with knowledge and understanding, Lord, to reach out to our children, to reach out to the children of the nation, to reach out to even the adults, King of Kings, and reach out even our families, my God, by this meeting that we have had today. I pray that you continue to strengthen us, O Lord, to live for you, my God, that what we have heard from here, we shall be able to go out and share the rest of the world and be able to help out a child come out of any mental disorder in any way, my God, in any trauma. I pray that you begin with us, you deal with us, you give our government, you open their eyes to get to understand that actually they need this knowledge, that people in the workplaces, they need to be equipped with the knowledge and to be helped to get out of any trauma experiences. Thank you, Lord. Continue to be with us from now and the rest of the years. In Jesus' name we pray. Amen and amen.
Amen. Thank you. Thank you, everyone, for being here. And we wish you a lovely weekend and God's blessings. Take care.
Thank you so much.